Oh, right. We had a request that came in that said, can you present something on breast and cancer areas since treatment is now being focused on the unique and rare type the patient is felt to have? And so what I did is I did some research, and in truth, there is a lot of different types of breast cancer. So each one of these I also footnoted, so our Replay Club members can use those footnotes and go directly to this website, which provided amazing information. So let's just do an overview quickly of some of these. The first one is ductal carcinoma in situ, Dcis. So when you're looking at the documentation, that's what you're probably going to see is Dcis, at least most of the time, because nobody wants to write out ductal carcinoma in situ. What you do need to know about this is that it starts inside the milk ducts. This is a common breast cancer. So you're going to see it often, but Dcis is known as a non-invasive breast cancer. It usually stays right there in the duct and doesn't go threaten other parts of the breast. So that's the takeaway from Dcis, but do know that it does increase the risk of getting invasive breast cancer later on. So it's not something that you want to take lightly. And going to the next one, we have several here, so we'll scroll down. IDC, invasive ductal carcinoma. So about 80% of all people have this type of breast cancer, and they provided this excellent image that I wanted to share with you, that if we scroll down just a little bit more, I can move my screen too because you're probably showing more, is with it actually shows you the parts of the breast. You know, we don't think of the breast being that complex, but actually it has a lot of parts. So this will show you the ducts, the lobules, and which we will be talking about, the areas that hold the milk for nursing. We have the anatomy, the nipple, fat. There's major muscle there as well, and then you've got the rib cage. So what they're looking for is normal duct cells. We want them to not be enlarged or abnormal. And what can happen, though, is that those ductal cancer cells can move and go through the, they say, the basement membrane. And then there's a little thing showing you what the basement membrane is. Moving on. Now that we kind of got an idea of the anatomy, IDC, this is tubular carcinoma of the breast, and this is the difference between this and the previous is that it the cancer comes out like little tubes or tubules, and that's kind of interesting. I didn't pull a picture of that one, but there are pictures of that you can see. It's a low-grade type of cancer, and the problem with this one is that the cells sometimes look like normal cells for a long time, so and it grows very slowly. So you might not get identified as having IDC right away. Then of tubular. Now this one was pretty fascinating. Medullary, and the reason it's called medullary, or I guess you could call that medullary, but think of the medulla. You know, you've heard of people say they're medulla oblongata. Well, the medulla part of the brain, it's kind of soft and spongy. Well, that's what this carcinoma looks like in the breast. And so because it's all soft, fleshy mass, it looks like the medulla in the brain, and so therefore they called it medullary carcinoma of the breast. I bet you won't forget that one, right? Then we have, this one was interesting too, not as fascinating as medulla, but muconus. think of mucus. That, I know that's not a very fun thing to think about, but this type of carcinoma in the breast is it's rare. It is invasive, and it's a ductal carcinoma again, but it actually kind of floats around, and they say it floats around in mucin, and it's slippery, and just it's kind of like mucus going around, okay? And so that was an interesting type. As we move on, and again, as a coder, we need to understand these different types. So it was a good question. Keep going. Got some good ones here. This was a great website. This one, Papillary IDC. This one usually happens to older women after they've gone through menopause, but what's unique about this one is that it looks like little finger-like projections, and I got this great image here. See how it's like little fingers? It's not that it's encapsulated, but you got that circle there, and the little fibers are looks like fingers, and so that's papillary. If you're familiar with your terminology, your medical terminology, papillary tends to be like finger-like. Then we have this one that's cribiform carcinoma. What it does is it makes like a nest-like formation in the ducts and the lobules, and what made it pop for me is this. They said it sometimes looks like Swiss cheese. It is invasive. The cells, again, like some of these others, will look like normal cells and behave like normal cells, and then they turn into carcinoma and start causing problems. So those are the IDC ones. Let's move on, and I think we're going to get into some more interesting ones. Invasive ductal carcinomas, so that's what those were. Now, this is invasive lobular carcinoma, a little bit different, ILC. All right, now it's just like it states, invasive. Not all, I mean, cancers are invasive, but when they distinguish or set aside that one is invasive in the description or the title, that means it takes over. So what was interesting about this one is that the AACS, or excuse me, the American Cancer Society, the ACS, it says that 180,000 women in the United States they find out they have this invasive lobular carcinoma. Now, a big, bad, scary type of cancer of the breast is inflammatory breast cancer. I would suggest, if you want more information about this one, that you go in and you Google some of the images. I was just talking to my mother-in-law today, in fact, and my father-in-law has leukemia, so they go into the cancer center, and I had mentioned that I was working on this breast cancer report, and she said, "Oh, I just feel so sorry for the people that have inflammatory breast cancer." And I thought, oh, she knows what that's called. It's terrible. You get this reddening and swelling, but what's unique about this is it sometimes can happen suddenly. And then all of a sudden, it's almost, think of, how if after you'd had a baby, maybe sometimes women get mastitis. It might feel and look like that, and then it gets really bad, really fast, and it's one that it requires a lot of treatment. However, they're better at it, at taking care of this than they were even like 10, 20 years ago. And as you do your research, you'll find out more information about that. Lobular carcinoma in situ. Now, the thing about cancers in situ, or CIS, is that they're encapsulated. Okay, one person had described cancers that were in situ like being in a little jelly bean, a little hard shell that it doesn't go out of that, and all the bad stuff's in the middle. So this would be lobular, it would be in the lobular part of the breast, cancer in situ, CIS, and it is, again, a type of breast cancer that some will say that it's not true breast cancer because, you know, you're thinking of breast cancer and it's invasive or it moves around, and this stays in one little place. So think of like a little jelly bean caught in the breast. But the fact is if you're diagnosed with this lobular CIS, you have a much higher chance of getting other types of breast cancer. I did want to make a note that lobular neoplasia, that is sometimes what you'll see it defined as is versus LCIS or lobular carcinoma in situ. So as we code and we're looking at the documentation, know that if you see lobular neoplasia, that's what they're talking about. Okay, and then we're getting into male breast cancer. I know that my students, when I was teaching at the college, were shocked when they found out that men can have breast cancer, and there's specific codes for breast cancer for men. And quite frankly, the fact is that everybody has breast tissue, and so if you have abnormal cells in any type of tissue, then it can turn into cancer, and so men have the possibility of getting breast cancer, but often they don't know what it is or they don't get it checked. That can be a problem. So now I want to tell you about one that is really in the news a little bit more than it used to be. My mother had just read an article about it, in fact, and it asked me about it. Paget's disease. It's actually a cancer that starts on the nipple of the breast and looks almost like a little eczema, and it can get worse and be irritated. Might itch, might not itch, may itch sometimes and not other times. The thing about Paget's disease is the fact that if you have that, 97% of the people that have this actually also have a DCIS. Okay, so if that is something that you're dealing with, or you've noticed, or somebody says something about it, they definitely need to go have that checked. All right, you know, you might think it's dry skin, but Paget's disease is again in the press lately, and it can be just scaly, red, itchy, and irritated. Okay, let's see, we've got some more. These are the biggies, though. Oh, this one. This is the last one we're going to talk about. I went ahead and pulled pictures of this because, quite honestly, I wasn't as familiar with this one as I was with the others. I knew about all the others. But this one is called Lotus Tumor. Now, this one is actually a tumor that makes a leaf-like pattern. Okay, and one of the things about it is the tumors are benign most of the time. Some are malignant, you know, and some are borderline, but for the most part, they're benign. But what do we know about benign neoplasms? They take up space, right? They cause problems. You can see by the pictures that we've provided here that it is, you know, it doesn't take long and it becomes an issue. So again, it grows very quickly. This is one of the best pictures that I was able to show you with different types. However, if you go and do a Google image, that was really scary. There's some, this is one that you want to catch and treat very quickly. So that kind of wraps up talking about the different types of breast cancer. Now that you know what they are and where they occur in the breast, and the names define where they're located, it'll help you with your coding and your understanding of breast cancer.
Thank you, Alicia.